Hello and welcome to this new video on the practical tips about bachelor therapy. First of all, I must thank all of you for appreciating my yesterday's video about how to create a combination, and especially with a practical tip when more than 10 remedies seem indicated and you want to make a combination of just three or four remedies out of them. So if you haven't seen that video, then do watch that video on our channel about how to make a combination for a patient when more than 10 remedies or more than 5 6 remedies they get indicated. So how to select remedies, how to prioritize remedies for making a combination. Do watch that video first. But then there is another common practical difficulty that every bachelor practitioner faces when you try to select a combination for yourself. This we used to call as medical student syndrome, which means that when you read any remedy, you feel like that remedy is just suitable for you. Any remedy that you read, you feel okay. You have experience, or you do experience those mental states, that symptom, that emotional feeling, and you feel like, yes, you read about. You read about Mimulus, and then you remember about the specific fears that you have. You read about large, and then you remember the lack of confidence, the events, the situation where you felt lack of confidence in you. You read Verwin, and you feel how at times when you become over passionate and uh, over enthusiastic for a cause. You read Holly, and you remember how you hate certain people, how you have some vindictive feelings about certain people, and how you want to reduce those feelings and instill love in your heart for those people. So you read any remedy and you feel okay, this is the rightest remedy for me, and I think I should take this remedy. So this happens with everybody almost, that whenever you read a remedy you feel like you should have that remedy. Whenever the patient talks to you, you also feel that every statement will lead to another remedy. But when you want to select a medicine for yourself, or you want to select a combination for other people as well, there has to be some tip, there has to be some clue, there has to be uh, some rule about how then we should select the remedy for yourself, or a combination for yourself. So the golden rule that I use for selecting a remedy for myself or for my patients is I ask one question: whatever mental state or mental symptom or the behavioral pattern or the temperamental issue that I am prescribing on, is it really hampering the productivity of me or my patient? We all pass through various emotions. We all pass through various feeling states. There are fears in our lives, there are anxieties, there are hates, there are loves, there are uh, aggressive feelings, there are over assertive feelings, there are enthusiasms, there are depressive moments. So our life is full of all these events. Our life is full of all the feelings, all the shades of various emotions. Whenever I teach during my workshops, I always tell my students that all these 38 states that each of these bachelor remedies they indicate or they take care of, we all have passed through all these states throughout our life, and we all will pass through these states in the rest of our lives. So do we have to take each and every remedy whenever it is needed? I don't think so. And you can't take, because you can't just have 38 remedies with you and sipping one or two or three drops from each and every bottle whenever you feel whenever you become aware of a particular emotion or a feeling. You can't do that. You really can't do that. So then how to select a remedy for yourself? So the key is that I use, I ask one question, just one question that you have to ask. Whatever feeling state, whatever temperamental pattern, whatever emotional issue that I am trying to treat, is it hampering my productivity? If it is hampering my productivity, then I must select some remedy for that or some combination for that particular thing. If it is not hampering my productivity, it's perfectly fine. It's perfectly fine. You don't need to treat that if it is not hampering the productivity. So I may have a fear of spiders. So I just read Mimulus and it says that it's for specific fears. Now I may have fear of spiders or fear of flying in aeroplanes. Do I need to take Mimulus? Yes, if I'm a frequent flyer. But if I just travel once in a while, I the last time I traveled through by a flight was, I think, in 2012. If that's the case, then you don't need to take Mimulus for fear of flying, because in any way you are not going to fly anywhere. It's not going to hamper your life in any ways, basically. If at all you want to fly, you can take Mimulus for those particular days. So you don't have to take Mimulus for removing your fear of flying for life. No, no, you don't need to do that. So that's the thing. So if that particular symptom, that particular feeling, that particular issue is causing loss in your productivity, if it is hampering your productivity, if it is creating difficulties in day-to-day life, then treat that first. Then select a remedy for that particular symptom or that particular feeling state, and then try to take remedies for the other things later on. So, one key that you can use to select remedies for yourself is first try to understand, first try to see exactly what you want to treat, and is it really hampering your productivity. Somebody who is a procrastinator like me, you have seen my videos now, they are coming after so many days. So, I have taken certain remedies for making regular videos, and I hope those remedies I will continue with taking those flower remedies. You can write in column in the comment section which remedies I might have taken, because my last few videos were almost a year back. I posted videos almost 1 year back. There was a long lockdown of 8 months, or more than 6 7 months now, where there was a lot of opportunity for me to create new videos, but I didn't do that. So you can imagine what remedies I might have taken, and you can write them in the comment section. uh, so we'll discuss that. So I have, if the product if the procrastinating quality of mine is hampering my regular video uploading and regular interaction with my fellow colleagues and students and all those things, then I should take a remedy for that, because obviously that will make me more productive, that will make me more efficient, that will make me more regular and sincere with my work. So the only key that you can remember when you are trying to prescribe for yourself or for your patients is first try to see what are the facets of the temperament, what are the emotional qualities of the patient which hamper, what are the liabilities, emotional liabilities that the patient is, or behavioral liabilities that the patient is suffering with. Treat them, and then you can treat the rest of the emotional issues later on if you feel like treating them. So the key is to remember and to apply the question, is it hampering the productivity? And whatever is hampering the productivity, whatever is not allowing the patient to use the his or her capacities to their maximum limit, try to treat that, and then you will be more and more successful in treating with Bachelor remedies. I hope you have liked this video. Please do write in your comments what you want to cover in our videos. We will be covering again with how to select a remedy based on the positive and negative feeling states. But do subscribe to our channel, do share our videos with your fellow colleagues and with your friends to know more about health, homeopathy, and bachelor remedies. Thanks.